starting with the mouth. As we all know that the mouth is, the beginning of digestion, right? And we actually have enzymes in the mouth that are starting to break down our food. But more importantly now, where we're kind of off with medicine, and I think there's a couple of speakers that are dentists in this year's program. But what happens is, in my opinion, is that dentists are the doctors of the mouth, and doctors are the doctors of everything else, and there's a lack of communication between these two parties. And in fact, we should be talking together, because now we understand that most of these diseases now are looking at different type of overgrowths and undergrowths of certain types of bacteria in the mouth. Dental health is super, super important. Now, doctors don't usually talk about it because that's the dentist's job, but we have to encourage our patients, even though we're not dentists, to actually have and go see their dental care. Make sure that they are going to the dental visits regularly, and more importantly, making sure that they don't have periodontitis, inflammation in the gums, or infections, chronic infections, or even people have risk of then getting more like root canals and things like that. But now we understand, like Alzheimer's disease, cardiovascular disease, cystic fibrosis, certain types of cancer like esophageal cancer, colorectal cancer, and more importantly, inflammatory conditions of the joint and risk of diabetes and pancreatic cancer are all now these are bacteria that we're now seeing that are evolving from bad dental health. And so what we have to be careful of is just kind of over sterilizing the mouth, right? So a lot of people grew up like, oh, I'm supposed to take some kind of Listerine-like product or Scope-like product, and here's some kind of antiseptic mouthwash, and they gargle to make their fresh breath, not understanding that that's just like the antibiotics. We're wiping out the bad stuff, but we're also wiping out the good stuff. Good dental care is just going to be brushing your teeth, flossing your teeth, making sure you're getting good regular dental checkups. And there's even natural toothpaste that actually can improve periodontal disease. I just had a client the other day. They had multiple pockets, about 7 millimeters on their gum line, and they were told that if they didn't get it fixed, they would have to have surgery. We told them to get some good dental care. We have some natural mouth cleansers that use natural antimicrobials that are not going to sterilize the mouth, but clean the mouth. They do the flossing, and they'd use the toothpaste, and then their pockets of 7 went down to 2s and 3s, which are normal. And the dental assistant told the patient that they've never seen this in all 20 years of their practice. So there is things that we can do to help regenerate those types of tissues, but understanding that the microbiome is starting from the mouth, because everybody thinks like gut. And remember, the gut starts in the mouth as well. So good dental hygiene is super, super important. Again, as doctors, we don't talk about it because that's not our specialty, but we should start leaning a little bit into that realm and saying, hey, let's find out, let's ask ask your patients now, if there's physicians or other people on the panel, we should be asking our patients about their dental health, because a lot of times we think someone else is doing it. And the key is that we should also be following that indirectly, because we can also assist with some of these other issues that dentists won't be able to treat. So it's nice to have a collaborative care team with each of our patients. Now, looking at the mouth, then it goes down this tube called the esophagus. Okay, so the esophagus is like the food chute. Food comes down and goes right here into the stomach. This is your stomach, and it's got the muscle layers around it. And this is what the inside of your stomach will look like. It's like kind of a red pouch. And I consider the stomach to be the Vitamixer. It's kind of this expensive blender that everybody wants to get in the restaurant industry. It makes blends anything into a smoothie kind of thing, and so or any of those fancy blenders, by the way. And so it's kind of like this. Things come in and it blends it very well. Now, what's inside the stomach is acid. Now, the stomach produces acid, and we need acid. The misunderstanding with right now with conventional GI is that a lot of people think that there's an acid problem. I'm getting, GERD, gastroesophageal reflux disease, right? We get a little bit of acid coming up here. Now, this tube here is not designed to have acid. This is like a chute, okay? So the cells that line this are very soft and very fragile. The cells that are in here have this nice thick mucus lining. You can see in this picture. I'll show you in another picture on the next slide. But it can handle the acid. In fact, there's a nice mucus layer. So our body produces acid to digest all your proteins, carbohydrates, fats, vitamins, minerals, things like that. But what happens is when there's inflammation here due to diet, due to lifestyle, more importantly, when there's inflammation due to antibiotics, proton pump inhibitors, stress, alcohol, we'll cover these things today, but that causes a dysfunction here to this lining. then once we have this nice, let me get to the next picture I can show you here. Once we have this nice glistening protective lining of mucus here, the acid is kind of like swashing around here. It's kind of like a washing machine. It's just kind of tumbling everything and kind of cleaning up everything. In this case, it's grinding everything. But when there's inflammation here or irritation due to chemicals and stress and alcohol and a lot of other things like non-steroidal anti-inflammatories like ibuprofen commonly, naproxen and those kind of things, they will cause a dysfunction here where it kind of ruins this lining. It gets inflamed. So we get a gastritis. Remember, inflammation, itis. So the suffix, anything that goes, at the end of the word, it says inflammation of. So arthritis is inflammation of your joints. Gastritis is inflammation of your stomach. Esophagitis is inflammation of your esophagus. Colitis is inflammation of your colon, et cetera, et cetera. You can listen to my previous lectures and I'll go through all the details of what inflammation is. And I'll be speaking also on Thursday about the stacking effects of inflammation. I'm going to go into that very, very specifically. So you'll learn a lot new different things than I spoke in the last 2 years. But going back to this, when we look at this GI tract, once it gets irritated and disruptive, then our own acid, which is natural, which is what we need, it actually irritates itself. And when it irritates itself, then we get more inflammation. We get pain, we get heartburn, we get reflux. Now, when people go back to having this reflux, usually it's due to a couple of things. We're usually overeating. In general, it's usually overeating standard American diet, pro-inflammatory foods, plus alcohol, tobacco, and a whole bunch of other things. But we eat a large meal at the end of the day, and we go home and we sleep almost pretty much after we eat. And then laying flat, then instead of this little sphincter closing up, the food, when it's blending here, it kind of goes upwards. And that's why people end up having heartburn at night. That's why they always tell people, why don't you raise your bed a little bit? And that will help kind of with gravity, keep this from going up, which is a wonderful thing. But more importantly, we want to look at what are those foods that are coming in. And that I'll be talking on Thursday about pro-inflammatory foods. I'll talk a little bit about today as well. And we have to look at what are we eating? Are we eating too much? And there's other issues where people can get like a hiatal hernia here, which is just an outpouching as well. Hiatal hernias, interesting enough, are related to a higher correlation of people who have chronic constipation. Because when we're trying to evacuate the bowels chronically for decades, when people have this, chronic constipation issues, then actually the force of this whole GI tract goes above this. There's a diaphragm over here, and it pouches out here. So actually, people who have chronic constipation have a higher rate when they have endoscopies, the scoping from above, of having hiatal hernias. So again, one way to help lower the esophageal sphincter issue and having the hiatal hernia is making sure that people are not constipated and eating more fiber in their diet, which I'll talk about. Now, even in the stomach here, there is, with an electron microscope, that's a super microscope. Now, again, so this is looking at just generally if we put a camera when we're doing endoscopy. But now when we look with a super microscope, we can actually see the little individual cells where the enzymes are coming out, the acid is coming out, where certain digestion actually starts to begin in the stomach. Not a lot, but a certain amount is actually occurring. But more importantly, there is a lining here that is full of probiotics. A lot of people think probiotics are just in the small intestine and colon, but actually there's probiotics in this is in the stomach. And also in this GI tract, there is certain types of bacteria that are good, and there's certain bacteria that are bad. One of them is called H. pylori, which many of you may have heard of. Many of you may have actually had H. pylori. Once we have an ulcer due to the inflammation, due to a variety of factors, then that bacteria is hanging around here, and it actually comes in and it lives inside the ulcer and prevents this lining from being covering the wound, and then our acid will continue to bother ourselves. And that H. pylori is a really, really stubborn bacteria. Why is it stubborn? Is because it is actually living in a pH of 1. The stomach acid here is hydrochloric acid, pH of 1 to 2 in the average person. So it's like if you ever had a pool and you go to mix with pool chemicals, you got to wear gloves that says hydrochloric acid, and you're changing the pH of the pool. If you drop that hydrochloric acid on the cement around the pool or the pool deck, you'll see that it burns a hole right through it, right? Because that's how strong this acid is in your stomach. So when we don't have that nice protective layer, then it's easy to cause ulcers and cause actually bleeding in the stomach, right? More importantly is that this bacteria, H. pylori, when it comes, it's very, very stubborn. Why? Because again, it's living in a pH of 1. So it kind of laughs at everybody. It's like, hey, what are you going to give me? I live in the most fiery, acidic part of our body. And that's why they usually have to give like what they call a triple cocktail, 2 antibiotics and an acid blocker for about 14 days to knock this out. Now, Now, we actually have natural therapies that about 5 out of 6 times in the last cases that we have that are very successful at knocking out H. pylori. Some people can't tolerate the antibiotics. Some people actually now have allergies to antibiotics because they've taken so many. And some people just want to avoid it, say, can I take a natural therapy? Yes, we can. But remember, the natural antimicrobials, although they're safer and more tolerable, still are knocking out good guys. So we still have to replenish even when we're doing natural therapies. Now, going now further into the small intestine. So here's the stomach up here, and then we get down in here to the small intestine. The small intestine now is like a hose. Okay, so it's like everybody went to the hardware store and bought a 35-foot garden hose. And that's about the size of our GI tract, about 35 feet on the average person. So it doesn't matter how skinny you are, if you were 90 pounds or you were 400 pounds, we still have the same hose. Okay, and so that's the parts at the hardware store that we bought. And it's floppy. It's not fixed. So the small intestine, I always tell people, is like spaghetti. If you stand on your head, you're doing yoga, you're rolling around playing with your kids, it kind of flops around. Whereas, the stomach is fixed, and the colon over here, let me show you the colon here. Colon here, it's fixed. It's got ligaments, and that's why we can put a scope and we can look and do a colonoscopy, thankfully, right? So we can do a colonoscopy, we can do an endoscopy here in the stomach, going over here. But this part of the small intestine is hard to see because it's floppy. So we can't stick a camera. Now, they do have technologies which is coming out. It's rare, but it'll be more popular over time, is that there's actually camera pills that people are now able to swallow. They're getting smaller, thankfully, as the years go on. So I remember when it first came out, it seemed like someone was swallowing a computer mouse. And I was like, wow, that's a long thing to swallow. Now they're getting smaller and smaller, like little pills. But it actually will go through this GI tract and take pictures automatically. So then they can look at it on the computer and they can see any other areas of lesions or damage or inflammation or disruption or cancers or bleeding in the small intestine, which we can't see now. But we do have certain tests now that actually can measure some of the dysfunction of the small intestine, and that's breath testing. And some of the dysfunction here that is called small intestinal bacterial overgrowth, which I'll talk about in a second. Now, more importantly, when we look at an endoscopy, now when we're looking at it here, remember, we saw the stomach, and then say we're looking at the colon. When they look at it with a camera, it actually looks like this, right? It's like this big pink tube, okay? And what they're looking for is polyps. Polyps are like little fat grapes, fatty tissue. They look like grapes. And the more polyps we have, the higher rate of those polyps turning into something not good for us, right? Because all polyps is a response to chronic inflammation of the colon. So when people have a low fiber diet, standard American diet, having a bowel movement every 2, 3, 4 days, some patients in Florida, men over 65, maybe every 7 days, sometimes every 10 days now, what's happening just due to the standard American diet, is that chronic inflammation in the colon due to just not having the bowel movement creates more polyps. Polyps is just a response of inflammation, and the body's kind of like extruding and kicking out the cells that are actually really hot and really inflamed. And so when you have a colonoscopy, thankfully, what we do is the GI doctor will clip out those little polyps and actually prevents, which is fantastic, by the way, prevents that little polyp from potentially turning into a cancer in the future. We can't see these things. We can't feel these things. And definitely there's no blood test yet for those things. And so getting a routine colonoscopy is especially if you're high risk or a certain age, definitely need to do that because they can actually eliminate your risk or catch things early enough. Unfortunately, with colon cancer being the number 2 cause of cancer in the United States, in both men and women, the number 2 cause of death outside of heart disease, which is number 1, we definitely need to address this GI tract issue with constipation and inflammation. Now, when we look at this colon tissue here, under the microscope again, and then my book covers this a lot, and I always talk about these little finger-like projections, this intestinal villi. These are the little spaces in between. So it looks like this from a gross camera, but again, when we look with a microscope, it's going to look like little fingers. This is the spaces where the food particles go in, okay, throughout this 35-foot tract. Now, when we take out this GI tract and we actually iron these little finger-like projections out, the surface area of your GI tract is 2 tennis courts worth of space, right? So it's huge. So a lot of people are like, well, I have a 35-foot tract. I'm maybe 120 pounds. Okay. But you still have 2 tennis courts worth of surface area. Remember, we have 100 trillion of 4 pounds of over 1,000 species of different good guys. But we also have a lot of space, and that's where the absorption, assimilation, excretion of taking all your foods and nutrients is occurring. Now, When we go to the colon again, it's fixed. So they can look at it with the camera. We can look at polyps. We can look at diverticulosis, which are pouches. We can diverticulitis, which is inflammation of the colon, making sure there's not colon or rectal tumors. Okay. But when we take a slice, this is a section here of intestine here. And we're looking at it, you can see there's muscle tissue. So that's what causes peristalsis, okay, like the squeezing effect of, moving the foods down. Stomach blends the food, remember, Vitamixer kind of production into a smoothie, and it comes down as a smoothie through this 35-foot tract. And as you can see, it's different shapes and sizes, different wrinkles. And then in each of these little wrinkles, those are those little tiny little finger-like projections. And I'll show you some pretty cool pictures here. This is what now, from an artist depiction now, when we're looking at the electron microscope and then using digital imaging of looking at, this is what it would look like. Little finger-like projections. It's pretty interesting. So even though we look at it, it looks like a pink tube, now we're getting like the smallest of the small. So this is looking at like those little spaces of where the food particles go in. And this is another artist depiction here of like then looking at molecules of like certain proteins or carbohydrates and fats and stuff going into these little spaces. Okay, so again, it's not just like this big flat pink tube. It's actually this little tiny little finger-like projections. And it's so important to understand that we have to maintain this barrier. We have to make sure that all of this is correct and making sure that we can restore this after it becomes dysfunctional. And then we got our little probiotics too. And so again, having over 1,000 of these different species, they're also lining. Probiotics I consider like the employees of your GI tract, the GI tract corporation. And they show up to work, and what they have to do is they have to assimilate these foods. They have to move the foods where they need to go. They also have to look at keeping your immune system strong. Remember, 80% of your immune system is in the GI tract. So these are things that we have to look at in terms of probiotics. But not only that is that certain probiotics, when they're missing, we actually have certain diseases. And now we're like actually looking at, in the last 3 years or 4 years, there's actually pharmaceutical studies which are looking at specific species that are related to our neurological function, which I'll talk about in a minute. Alzheimer's diseases, autism diseases, schizophrenic diseases are now being related to dysfunctions of the gut. Dysfunction and loss of certain species of probiotics. And when they have replaced them in the clinical trials, interesting thing, 70% improvement of those symptoms. Again, we're talking about gut function treatment, not anything in the brain. So where the disconnect is that neurology has been treating all these things because they're doctors of the head, but we have to understand that a lot of this dysfunction of neurological issues now, which I'll show you also, is coming strongly from the gut. And that's why they don't respond to a lot of the neurological treatments, but they do respond better when the gut is healed and fixed. So interesting understanding this is key going forward.